بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. This is a new OSCE case number 5, and we have the first question: what is the clinical presentation of this child? The clinical presentation of this child is signs and symptoms of obstructive hydrocephalus, like vomiting, headache, and ataxia. What also sometimes at the time of presentation, sometimes patient presented with CSF seeding. The second question describes the radiological finding of this patient. As we see here, this is CT scan uh, without contrast, and we see mass in the posterior fossa with effacement of the fourth ventricle, the mass probably arising from the uh, cerebellar vermis and causing obstructive hydrocephalus, as we said in the clinical presentation. The mass is hyperdense due to cellularity of the mass. What are the main differential diagnoses? The main differential diagnosis is as we said in this child, we have medulloblastoma, one of the differential diagnoses. Second differential diagnosis, ependymoma, and the third differential diagnosis is pilocytic astrocytoma. What is the next step for this patient to reach our diagnosis? The next step is to do MRI. What we see in this MRI, we see this is the diffusion and this is the ADC map. And the diffusion, we have restricted diffusion, means that due to high cellularity of the tumor, it is hyper intense and low signal intensity in the ADC map. So what is our differential? What is our diagnosis now? Our diagnosis now, it is a medulloblastoma. The other why it is medulloblastoma, as we said, it is hyperdense on the CT scan, and it is on non-contrast study and restricted diffusion in the MRI with low signal intensity in the ADC map. And even ependymoma, it is heterogeneous enhancement, and it is a plastic tumor and usually arises from the floor of the fourth ventricle. Pilocytic astrocytoma, we have cystic mass with enhanced mural nodule, and it is more laterally on the cerebral left hemisphere. What the next question: name three syndrome associated with medulloblastoma. We have Goodwin syndrome, we have Gardner syndrome, Goblin syndrome, and Coffin-Siris syndrome, and Tourette syndrome. And there are another syndromes mentioned in the textbook. Please refer to that. Thank you very much for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك استغفرك واتوب اليك.